Sedatives and the hypnotic drugs. As the name indicate, sedatives, the drugs which sedates the nervous system, central nervous system, CNS, the drugs which sedate the patient, calms the patient, and hypnotics, the drugs which produce the hypnosis, we can say the drugs which produce the sleep resembling to the normal sleep are called hypnotic drugs. Sedatives in the large dose may act as a hypnotics, and the hypnotics in the small dose may act as an sedatives. So we can say the sedatives is the first step before the hypnosis. The objectives of lectures are different types of anxiolytics. Anxiolytics, the drugs which are used in treatment of anxiety are called as anxiolytics. The drugs which are used in the treatment of anxiety. And anxiety, generally anxiety is a fear, stress, tension, anxiety. So the anxiolytics are the drugs which are used to treat anxiety. And generally sedatives are the used in the management of the anxiety. Then the second objective is pharmacology of different types of anxiolytics. Benzodiazepine antagonist and pharmacological actions, and advantage of benzodiazepine as sedative hypnotics as compared to barbiturates. Let us see one by one. The sedatives and the hypnotics drugs are classified into two main categories. Generally, the broad category is two: benzodiazepines and barbiturates. Both start from the B, benzodiazepines and the barbiturates. The most commonly used and the advantage, due to advantage, the benzodiazepines are commonly used sedative hypnotics, benzodiazepines. Barbiturates having some more little bit adverse effects as compared to benzodiazepines, we will see in the next slides. And third category is the miscellaneous drugs. These are the drugs which is not in the category of benzodiazepines and barbiturate, but they shown their pharmacological activity as sedative and hypnotics. We will see where the sedative and hypnotics are used. What are the indications of the sedative and hypnotic drugs? In which persons, which patients we need to use the sedative and hypnotics? Before going to their indications, let us see the what are the benzodiazepines. Let us see the pharmacokinetics of the benzodiazepines. Generally, they are well absorbed orally. It is available as oral tablets. And amongst the benzodiazepines, which are the benzodiazepines, the examples of benzodiazepines, generally benzodiazepines are divided into three main categories: ultra short acting, which having T half less than 6 hour, And examples are midazolam and triazolam. Then intermediate acting, which is having T half. T half, T means time, half 50%. The time required to eliminate 50% of the drug from the body. Intermediate acting, which is having T half near about 60 to 24 hours. And examples are the lorazepam, oxazepam. And the long acting, which is having more than 24 hours T half. And the examples from these categories are the diazepam, chlorazepate, and clonazepam. If you see, the common suffix for the benzodiazepines are pam, pam, lorazepam. If you see, the common suffix are zepam, lorazepam, diazepam, chlora, uh, clonazepam. So when there is a last name is zepam, these are the categories from the benzodiazepines. Chemically, it is called benzodiazepines. So let us see the pharmacokinetics. Generally, chlorazepate, which is a long-acting benzodiazepines, is a prodrug and which is activated in the stomach by gastric acid. Now, what is a prodrug? Prodrug means it is in vivo outside the body, it is inactive. But when it goes into the body, metabolized by the liver, it is converted into the active drug, pharmacological active. So it is generally activated in the stomach by the gastric acid. So it needs the gastric acid, or we can say acidity is one of the requirement. It is activated in the environment of acidity, which is available in the stomach. So if you are prescribing the clorazepate with the antacid, so what is the role of antacid? Generally, antacid, it will increase the pH, and if the pH is increased, so this prodrug clorazepate is not be able to active. So avoid its administration simultaneously with antacid. If you prescribe the clorazepate with the antacid, it will be not able to give the optimum pharmacological effect, because clorazepate need acidic environment to be activate, and antacid increases the pH. So avoid the use with the antacid. Then these are metabolized by the, all benzodiazepines are oxidized first and then they are conjugated, and their inactive metabolites are excreted by the kidney. Except some lorazepam and oxazepam, they are get conjugated, and clonazepam, which undergoes nitro reduction. But if the patient or person having liver disease, if the person having the liver disease, the metabolism is not able to done properly, oxidation will be impaired, generally in the elder person. And this medication is also generally indicated in the elder person due to some CNS disorders. So the drug dose calculation is very important. If the liver disease and oxidation is impaired, there may be the higher level of the plasma concentration of the drug. So the dose reduction is very important if the person having liver disease. And we know that the drug generally bind to the plasma protein, And what is the advantage of the binding of the plasma protein? If the drug bind to the plasma protein, and binding of the drug leads to the long duration of actions. Now, generally, midazolam is used in the endoscopy. Midazolam, the indicated in the endoscopy. Triazolam is having the amnesia. Amnesia is considered as a short term loss of memory. The patient is unable to recall what happened during the drug period. Lorazepam, it is a safe in the liver disease and preferred in the elderly. In the old persons, generally, if there is a two drug, diazepam and the lorazepam, which should you have to prefer? The best one is lorazepam as compared to diazepam, because lorazepam metabolism is not affected if the person having liver disease. The lorazepam metabolism is not affected if the person having liver disease. So it is safe in the liver disease and the preferred in elder. Same lorazepam and oxazepam. Long acting diazepam, it is having the rapid actions, and the as we discussed clorazepate, it is a prodrug activated by the gastric acid, and clonazepam, which is also having the anti-epileptic activity. So clonazepam is also indicated in the management of epilepsy, that is the convulsions. What is the mechanism of action? How they act? Benzodiazepines generally stimulates the benzodiazepine receptor, and it after the stimulation of the benzodiazepine receptor, it augment the action of the GABA, gamma amino butyric acid. Generally on the GABA A receptor, gamma amino butyric acid A receptor. And what happen if there is a stimulation of benzodiazepine receptor? There is increase in the influx of the chloride ion into the neurons. So chloride ion is responsible for the inhibition of the central nervous system. If there is increase in the inflow inside the neuron, chloride ion into the neuron, and this chloride ion is responsible for the neuronal hyperpolarization. And when there is a neuronal hyperpolarization, it it may leads to decrease the neuron excitability. And if there is a decrease in the neuron excitability, there is an the inhibition of the central nervous system. And inhibition of the central nervous system means it sedate the patient, calms the patient. There are six benzodiazepine receptor subtypes: benzodiazepine 1, 2, 3, 4, 5, and 6. But benzodiazepine 1 receptor mediates the sedative and anticonvulsant effect. So, for the sedative and anticonvulsant, anti-epileptic effect, the drug should be act on benzodiazepine 1 receptor. And for the anxiolytic effect, anxiolytic means anti-anxiety effect, the drug should be act on benzodiazepine 2 receptor. What is the pharmacological effects, where it is used, where is the benzodiazepines are indicated? Generally the benzodiazepines have anxiolytic effect, anxiolytic anti-anxiety effect in the patient of the anxiety, to calm the patient, to relax the patient, to sedate the patient, because in the anxiety there is a excitability. So to reduce the excitation, this drug generally used to calm down the patient, and it will sedate the patient. The thinking in anxiety, there is we can say abnormal thinking. In the anxiety there is abnormal thinking. What will happen, what will happen, what will happen? So due to abnormal thinking, there are the anxiety symptoms, the feeling of uncertainty. So benzodiazepines calm the patient, and patient is not able to think. No think, patient is not able to think, no tension, no stress. So this is a principle to treat the patient of anxiety, to sedate the patient, so thinking and uncertainty, abnormal thinking will be reduced. Then sedation and hypnosis, the patient which are not able to sleep, and generally they reduce rapid eyeball movement sleep. As we know that the sleep having the some patterns: eyeball movement sleep, non-rapid, and the rapid. So it generally reduce the rapid eye movement sleep, and it produce the sleep resemble resemble to normal sleep, natural sleep. Central skeletal muscle relaxation, it also relaxes the muscle, skeletal muscle, because if the benzodiazepine sedate the patients, so skeletal muscle also are relaxed. And as we know that in the anxiety, the skeletal muscle tone will be increased. There is also headache and the somatic pain. So it will decrease the skeletal muscle tone and useful in the treatment of anxiety. But as it is and the skeletal muscle tone decrease, we are not recommended this drug to the patient of myasthenia gravis. Myasthenia gravis with anxiety, because in the myasthenia gravis there is a weakness of the skeletal muscle, already weakness of the skeletal muscle. So if we prescribe the benzodiazepines in the patient of the myasthenia gravis, it will potentiates the manifestations of the myasthenia gravis. The benzodiazepines are also indicated in the convulsion and epilepsy, because in the convulsion and epilepsy there is hyper excitation. The neuronal firings are higher, neuronal firings are higher. To calm the patient, to sedate the patients, is the only way to manage the epilepsy. So generally the clonazepam is effective in treatment of petit mal epilepsy. Petit mal, the petit mal is also called as absence seizure, and it is generally observed in the children. And petit mal epilepsy lasts a few seconds. And myoclonic epilepsy, as the name indicates, myo, it includes the muscle stage, muscle contracted in the children. And the diazepam is effective in the treatment of all types of epilepsy because diazepam has the long duration of action, more than 24 hours. So once a day dose is required. Diazepam also indicated for the status epilepticus. Status epilepticus means this is a step of the epilepsy, and this epilepsy attacked maybe more than 5 minutes, loss of consciousness, or maybe within 5 minutes, two or more attacks. So these are the drugs which are used in the management of petit mat, myoclonic, and the all types of epilepsy, but except the strychnine induced convulsion. So here these benzodiazepines are not effective in the treatment of the strychnine convulsion. What is strychnine? Strychnine is the natural product, plant product, and it is from the name of the plant is Nux omica. Nux omica. It is like the fig-like seeds are there, and in strychnine, it is a natural plant. If the person eat this strychnine plant product, they may leads to convulsions, and the convulsion is produced by the strychnine is by glycine receptor. Strychnine is a glycine receptor blocker. Due to the blockage of the glycine receptor, there is a convulsions. But our benzodiazepines act via benzodiazepine receptor. They will activate the benzodiazepine receptor. So the benzodiazepines are not effective in the management of the strychnine induced convulsion because the strychnine induced convulsion is via which route? Via glycine receptor blockage, and our benzodiazepine will not open the glycine receptor. That's why. Therapeutic uses of the benzodiazepines. As we discussed, it is used in the management of anxiety, insomnia in the patients or persons which are not able to sleep, skeletal muscle spasm because these drug produce the skeletal muscle relaxation, convulsions means epilepsy, except strychnine convulsion. Pre-anesthetic medication to sedate the patient. Benzodiazepines are also administered pre-anesthetic. Pre-anesthetic means before the anesthesia, before the giving anesthesia, the benzodiazepines are administered. So what will happen? Due to benzodiazepine, the dose of the anesthetic medication will be reduced. So example, if in the surgical procedure the anesthesia is required 5 ml example. And if we give the benzodiazepines just before they're giving the anesthesia, so it will reduce the dose of anesthesia, like maybe it will be need the 3 ml. So it will reduce the dose of anesthesia, and it will reduce the adverse effect produced by the anesthesia. What are the other advantage of benzodiazepines in surgical procedures? It sedates the patient, calms the patients, and the most important is skeletal muscle relaxant activity. And it is the generally in the surgical procedures, the skeletal muscle relaxant activity is important. During anesthesia, to potentiate the effect of anesthesia, it is also added to the anesthesia for the uh, generally used in the management of the surgical procedures to relieve the pain and some shots of the consciousness. During endoscopy, midazolam, the short acting, the ultra short acting barbiturates are used, and the off label, we can say, it is not approved by the FDA for the alcohol withdrawal. Alcohol withdrawal symptoms, when the person is alcoholic for the long time and he is withdrawn from the alcohol. So due to withdrawal symptoms of alcohol, there is a anxiety, excitability, and skeletal muscle contraction. So to reduce these anxiety, hyperexcitability, to sedate the patient, to calm the patients, it is also recommended for the alcohol withdrawal conditions. Generally, triazolam, the half life is near about 2 to 3 hours, and as the half life is very low, so if we have to give to the patients, the frequent dosing is required. Means in the day, the drug should be taken for 3 times or 4 times, and generally the 3 times or 4 times drug adherence to the patient is difficult, so it is not used for the anxiolytics. Triazolam also used in the treatment of sleep onset insomnia. Sleep onset insomnia means difficult to getting to sleep. The sleep onset, the startup of the sleep, we can say it is a startup medication to sleep. The sleep is not able to get to start the sleep. Yes, and because it is only the duration of action is only 2 to 3 hours. Yes, very nice, short half life. So it will produce the sleep, and if the sleep is started, no problem, it will be continue. So for the sleep onset insomnia, the triazolam, or we can say short acting benzodiazepines, are good. And amnesia is a side effect. Amnesia, just short term loss of the memory. Then second drug is temazepam, which is having the half life of 8 hours. And 8 hours, it is the best drug for the person with early morning waking. 8 hours sleep is very important and good for the human. So if the person take the temazepam, the patient or person will sleep 8 hours. And obviously these are the drugs, these are the not the natural product, they will produce the drowsiness as an adverse effect after the sleep. The patient in the natural way, if we get the natural sleep for 8 hours, and after that we feel very fresh. But by using the temazepam or any sedative hypnotic drugs, if we will get the sleep, after the sleep we will not feel the like the fresh one as compared to natural one. The drowsiness is adverse effect. and it is used in treatment of sleep maintenance insomnia. Sleep maintenance, it will maintain the sleep for 8 hours. There is another drug, flunitrazepam. Flunitrazepam, but it is generally used, misuse. What is the flunitrazepam? It is one of the most potent and effective hypnotics of the benzodiazepine. When taken orally, it induces deep sleep and almost unconsciousness in about 10 to 20 minutes. So it is not generally recommended by any physicians or consultant, specialist consultant, because potent one. It induces the deep sleep, almost unconsciousness, about 10 to 20 minutes. So it is completely tasteless, and due to this advantage of the tasteless, it is misused in spiking drinks in social settings for the gambling purpose and for some criminal purpose. The drug may be misused due to it is tasteless, and it is generally added in the drinks. Clonazepam, treatment of epilepsy, and it is also approved by the FDA for the management and treatment of panic disorders. Alprazolam, it is having half-life near about 6 to 12 hours. It is also addictive drugs. It is also found to be having the antidepressant activity, and it is generally used in the treatment of the panic disorder and agoraphobia. Agoraphobia means there is a fear of the open space, fear of the crowd, and so this is more selective drugs for the agoraphobia and the panic disorders. The clonazepam and the alprazolam, these are approved for the panic disorders, but the treatment of panic disorder should be continued for the period of 12 to 24 months, 1 to 2 year. After the symptom remission, if there is a no symptoms of panic disorder, still patient have to continue the drug. Why? To relapse the symptoms, because some symptoms maybe occur, reappears. So that's why the gradual drug discontinuations over 4 to 6 months. So treatment is for 2 hours, and after 2 hours, suppose example, the patient feels well without panic symptoms, the treatment should be continued for next 4 to 6 months for the gradual withdrawal of the dose, otherwise the symptoms will be reoccur. And the benzodiazepines are the most commonly prescribed drug for the rapid relief of anxiety symptoms. So generally benzodiazepines are preferred. Adverse effect, documented hypersensitivity, allergic reactions to the drug, Related to the central nervous side effects: sedation, confusion, dysarthria, diplopia, double vision, dull attention, disturbed memory, and delayed reaction time. The activeness of the person will be inhibited. And use of the benzodiazepines or any drug which interact with the CNS may leads to dependence or addiction, and the benzodiazepine should not be stopped suddenly, because sudden withdrawal of drug may leads to rebound anxiety and insomnia. And the disinhibition in the children. Disinhibition means abnormal behavior, unaccepted behavior in the children. And if it is given by the rapid intravenous injections, it may inhibit the respiratory center, apnea. And which is the antidote for the benzodiazepines? Yes, this question is very important for your MCQ. Antidote for the benzodiazepines. Remember this flumazenil. Flumazenil is an antidote for your benzodiazepines. For MCQ, remember antidote for benzodiazepine, flumazenil, which is the competitive blocker of benzodiazepine receptor. The adverse effect of benzodiazepine in children include drowsiness, oppositional behavior, and disinhibition and the fatigue. Contraindication and the cautions. Car driver, why it is contraindicated or great caution should be taken for the car drivers? Because it sedate the patients. Confusion and delayed reaction time, and we know that during the car driving we have to be active. The seconds and the parts of second is very important to take the any action while driving. So due to sedation, confusion, and delayed reaction time should be contraindicated in the car driver. In the pregnancy, it should be contraindicated because it causes the arrhythmia of the fetal heart, abnormal heart rates, maybe tachycardia, maybe bradycardia. Lactation, because it pass in the milk, and hypotonia, tones are reduced and impaired the suckling, impaired the suckling power of the baby. Hepatic encephalopathy, the metabolism. Generally, in the older persons, metabolisms are decreased, and due to decrease in the metabolism, so great caution should be taken when if the drug is metabolized by the cytochrome P family and metabolisms are decreased, so the dose calculation is very important. Respiratory insufficiency, because it will depress the respiratory center, so it will potentiate the respiratory insufficiency. Myasthenia gravis, as the benzodiazepine decreases the skeletal muscle tone, and in combination with other CNS depressant, it will potentiate the CNS depressants, which may leads to coma. So this all about the benzodiazepines. Now the second category of the sedative hypnotics is barbiturates. Barbiturates. Benzodiazepine and barbiturates both are different categories. Don't confuse with the B. Benzodiazepine barbiturates. Which are the drugs in barbiturates? Ultra short acting, the duration of action is 15 minutes and onset of action is immediate. The examples are the thiobarbitone, hexabarbitone. Now, if the suffix of the drug is barbitone, so these are considered as barbiturate. And if the suffix of the drug is zepam, these are considered as benzodiazepines. Ultra short acting, thiobarbitone, hexabarbitone. Short acting, secobarbitone, pentobarbitones. Duration of action of the short acting barbiturates are 2 to 4 hours and onset of action is within 15 minutes. Intermediate acting barbiturates 4 to 6 hour, onset 30 minutes. And the long acting barbiturates is only for 6 to 8 hours and onset are 60 minutes. Intermediate actings are the amobarbitone and the long actings are the phenobarbital and the barbital. So if the suffix is barbital, these are the barbiturates. Kinetics absorbed well from the GAT and it is also available as a injectable. So uh, the most widely used also during the anesthesia. So injections and the GAT route is available, distributed all over the body and cross the blood brain barrier. Generally it is excreted in the urine, and that's why its excretion increase in the presence of alkaline urine, because barbiturates or another name is barbituric acid. So these are the acidic drug. So alkalization of the urine increase the ionization of the drug and increase their excretion. So in the this concept is useful in the management of uh, acute barbiturates toxicity. If the patient take excess amount of the barbiturates by mistakenly or dose is higher, to remove this dose, because the barbiturates is the barbituric acid, the nature is acid. So for the removal of the acidic drug from the body, we have to make the urine alkaline, and this alkalization of the urine increase the ionization of the drug, acidic drug, and this ionization may leads to increase the excretion from the body. So in the management of the acute barbiturate toxicity, and the barbiturates are enzyme inducer, increase their metabolism and increase the metabolism of other drug. If they are enzyme inducer, so for other drugs, if the enzyme inducer increase the metabolism of other drugs, and what happen if the metabolism is increased, excretion rate is increased, and the excretion is increased, the peak plasma level is not able to achieve which is required for the pharmacological actions, so it will decrease their effect. So enzyme inducer will decrease the effect of other drug. Enzyme inducer will decrease the effect of other drugs. Regarding the mechanism of action, the mechanism of action is the same as we seen in the benzodiazepines. Barbiturates also stimulates the GABA receptor. Now, in the benzodiazepines, the GABA receptor is stimulated by the benzodiazepine receptor. First, there is a stimulation of the benzodiazepine receptor and then stimulation of the GABA. But here, barbiturates directly stimulates the GABA A receptor, increase the release of the GABA, gamma aminobutyric acid, and the stimulation of the GABA receptor is open the chloride channel, increase the chloride influx, same as benzodiazepines. Increase in the chloride influx, hyperpolarization of neuron, and inhibition of the neuron, inhibition of the CNS. So mechanism of action for benzodiazepines and barbiturates are same. Stimulation of the gamma aminobutyric acid GABA receptor, which is generally inhibitory neurotransmitter, and this GABA receptor responsible for the stimulation of the GABA receptor responsible for the increase in the chloride influx, and this chloride ion is responsible for the hyperpolarization and inhibition of the neuron and sedate the patients. Increasing the dose of barbiturates, there may be generalized CNS depression. So the barbiturates, the dose is very important in regards of the barbiturates. What is the pharmacological effects? Sedation in the small amount, as and the hypnosis in the large amount. As I told you before, the the sedatives in the large dose may act as a hypnotics, and hypnotics in the small dose may act as the sedatives. So it is a sedation in the small dose, just calm the patient, and hypnosis may sleep in the large dose and decrease the rapid eye movement sleep. Also used, it is also having the anticonvulsant, anti-epileptic activity, also used to manage the anesthesia and the potentiate the effect of analgesic, same pharmacological effects as benzodiazepines. Barbiturates pharmacological effect on the cardiovascular system. It also decreases the blood pressure due to direct vasodilation, decrease the blood pressure due to direct vasodilation. So large and toxic dose may leads to affect the cardiovascular system, decrease the blood pressure due to direct vasodilatory effect. In the respiration, it inhibits the respiratory center by decrease its sensitivity and the blood level of the carbon dioxide. So respiratory depression is an adverse effect of the barbiturates. So the first one is a Remember, the pharmacological effect on the cardiovascular system is decrease in the blood pressure due to direct vasodilation and vasomotor center inhibition, VMC, vasomotor center inhibition. In the respiratory, inhibit the respiratory center, RC. In the GIT, decrease the GI motility, direct inhibition of the intestinal smooth muscle. Renal effect, decrease the urine volume due to decrease in the blood pressure and increase in the antidiuretic hormone release. And in the liver, microsomal enzyme inducers, so it affect the all the systems. Therapeutic indications where it is used: barbiturates, treatment of anxiety, treatment of insomnia, treatment of convulsion, treatment of epilepsy, anesthetic in the short operation. Generally, ultra short actings are used for the 15 minutes operation, 50 to 20 minutes operation. The ultra short acting barbiturates are generally used. And with analgesic, to increase the effect of analgesic by its effect on microsomal enzyme system. It is an enzyme inducer and used for the treatment of neonatal jaundice kernicterus. Remember, kernicterus is an the neurological condition, and if the kernicterus left untreated may lead to cerebral palsy. Generally, in the neonatal jaundice, there is increase in the bilirubin level. We can say hyperbilirubinemia, and due to this increase in the bilirubin level, and if it is left untreated, it may lead to cerebral palsy. So, kernicterus is a neurological condition. So, what is the role of here barbiturates? Barbiturates, as in the neonatal jaundice, there is increase in the bilirubin level of the blood. So barbiturates will increase the conjugation and excretion of bilirubin and decrease the level of bilirubin in the blood. How? Barbiturates increase the conjugation and excretion of the bilirubin and found to be useful in the management of neonatal jaundice in which there is increase in the bilirubin level in the blood, hyperbilirubinemia. What is the difference between convulsion and epilepsy? Sometimes the cause of convulsion is unknown. If the patient has convulsion, it doesn't necessarily means the patient has epilepsy. Epilepsy is a chronic neurological condition, and convulsion can be the reaction to a single medical event or part of the medical condition. Sometimes convulsion is occurs in some situations, but it is not that it is epilepsy. But epilepsy is a neurological disorders.